Good morning.
Good morning. Morning, Chase.
Morning, Ron. Can you guys hear me?
Yep.
Maybe I can't hear you. My speakers are. Hi. This is Chase.
You're muted, Chase.
Hey, Ron, you can hear me okay?
Yeah.
Excellent. Thank you.
Brian, good morning.
Good morning.
I saw your email here about the past steps for executive session, so thank you for that.
Yep, you're welcome.
I might modify the time frame.
Sure.
Commissioner Anderson,
Good morning, sir.
good morning. How are you?
I am fantastic.
I was going to ask you a favor, sir. I don't know if it's happening on your side, but your mic is very choppy.
Hmm,
Yeah, I hear that too.
interesting.
Sometimes signing out and signing back in can help.
Okay, well, I'll try that.
Thank you.
That any better?
Yes, quite good. Thank you.
Okay, good.
You solved it.
It's good. Thank you for catching that. Okay, well, it's 8:30. by my time here. (8:31) actually. So I will open the meeting. It's 8:31. Welcome to the Yakima Board of Health meeting for April, what the heck is the date? April 28th, 8:30. Our meeting will last from 8:30 to 10:30, and we will be going into executive session here in a minute. And I will ask that those who are not board members or the legal counsel can stay on, but I ask all visitors to please sign off as we will be going, or hold on, and we will be going into executive session.
Actually, Commissioner Anderson,
Yes, correct me.
you should have, yeah, all the board members and people going into executive session should have received a link to go into a different Zoom.
Yeah, yes.
Okay.
Thank you. Yep. All right. So with that, I think we will begin with the executive session. So if everyone wants to go to executive session now, the time is 8:32 by my clock. And so we will begin for 25 minutes. We will come out of executive session. Oops.
Mayor Byers. Hi, good morning.
Good morning.
We actually went into executive session just now. Ron, I sent a link this morning with that information. It should be titled executive session. So if you want to leave this meeting, go to that executive session, and when it's done and over with, you can join this meeting again.
Okay, I just went in there and it wouldn't let me in, so I'll go back there again.
Okay, you can give me a call too if you have trouble. I'll try to help you out.
Okay, thank you.
Of course.
We are back. We are out of executive session and we are back into our board meeting. And so I want to welcome everybody back and thank you for your patience on that. If I can click the right button here, we will get going. So I want to ask Andre, or excuse me, Mr. Elliott, are you with us?
I'm here, Commissioner.
I need a little guidance on, because I've never done this executive session before. So is there anything that we need to take care of right now for executive session?
So at this point in time, the board has concluded the executive session related to the performance of a public employee for Andre Fresco. To the extent that the board is interested in taking any action now or discussing any issues related to areas of salary, step increase, those sorts of things, it's up to the board if that decision is being made now. Obviously, the board does not need to make any decisions related to those issues today, but to the extent that there are now any issues related to discussions about step increases, salary, or any of those things, it is up to the board to make the decision to do that.
Thank you. I will ask then if the board would like to entertain doing that now or do it at another discussion meeting.
Well, Commissioner Anderson, I would move that we not do anything further at this point in regards to any of those subjects, since we have not had any, I personally have not had the ability to actually know what the current compensation is, what the history of compensation, you know, what that has looked like, or any guidelines in that regard. So I would move that we table any action at this point.
Okay.
I'll second.
Second, it's been moved and seconded to postpone any discussion or motions on prospective salary or compensations for Director Andre Fresco. Is there any further discussion?
Well, I would just like to point out that normally this is a process that would have happened in December of last year. And Andre has been working extremely hard since that time without his expected step increase. And I think putting it off more than 4 months is a bit much to ask of anyone.
Yeah.
I think all the comments were, I mean, essentially they're virtually all positive about him. I feel that we could not table this and approve his step increase.
One
Dr.
thing I
Curry,
would,
I know that you're not talking about executive session, I'm sure, but I would say that we do not have any documentation right now as far as our proposal. We, as Commissioner Lydia said, we don't even have an idea right now of what his salary is or what's being proposed or requested. I do agree with you, Dr. Cleary, that he has done a tremendous job, and I do believe we need to pick this topic up expeditiously. I know that we have another meeting in 2 weeks. I would ask if we could be supplied some kind of information as a board regarding salary and what is maybe being proposed as a step increase so that we can make a decision as quickly as possible.
Is that a motion, Commissioner?
Yes, I would ask who would be the responsible party for compiling that information?
I believe Ryan would have that information.
Okay.
But the motion is to postpone this. So if you want to make a friendly amendment to the
I'll make
motion.
a friendly amendment that we postpone it so that we can be sent documentation in interim and that we pick up this topic at our next special meeting, which is May, Ryan,
May 12th.
May 12th.
And I'm
I
willing to
second.
accept that. I'm willing to accept that friendly amendment. I think we want to do it in a timely fashion. I have
Yes,
an argument with Dr. Cleary's suggestion. We want to do this sooner rather than later.
Okay.
I just need
absolutely.
information in a framework to be able to make a good judgment.
Any further comments? Hearing none. All those in favor?
Aye.
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 All those, thank you. All those opposed? Motion passes. We will then have the information sent to the board Ryan, if you would do that, and then we will take this matter up at our May 12th meeting. And so that'll be placed on the agenda, please. Thank you. And if we're ready, Ryan, I will ask you to introduce our staff and guests.
Okay. Dr. Sean Cleary, citizen member.
Present.
Commissioner Amanda McKinney,
Present.
Commissioner LaDon Lindy,
Present.
Mayor Patricia Byers, citizen
Good
representative.
morning.
Nyla Duval, city representative.
Present.
Dr. Dave Atterbury, citizen representative.
Present.
And Chair, Commissioner Ron Anderson, Commissioner.
Present.
And the Yakima Health District staff, Andre Fresco, Executive Director.
Here, thank you.
Myself, Ryan Ibach, Chief Operating Officer. Chase Porter, Senior Finance Manager.
Present. Good
Melissa Sixberry, Director of Disease Control.
Morning.
Lillian Bravo, Director of Public Health Partnerships.
Good morning.
Sean McGee, Director of Environmental Health.
Good morning.
Nathan Johnson, Local Emergency Response Coordinator.
Morning.
Dr. Larry Yeka, Health Officer.
Here.
Wendy Garcia, Public Health Technician.
Here.
Victoria Reyes, Administrative Assistant.
Present.
James Elliott, Yakima Health District Attorney.
Good morning.
Yasmin Barrios, Epidemiologist.
Here.
And Kelsey Schindler, Public Health Nurse.
Here.
And at this time, I will turn it over to Melissa Sixberry to introduce her two new staff.
Thank you, Ryan. So we're excited to welcome two new staff members. We have Dr. Yasmin Barrios, who is an epidemiologist. This is a new position for the Yakima Health District, so I'll just let her give a little bit of background on herself.
Good morning, everyone. As Melissa mentioned, my name is Yasmin. I recently finished my doctorate studies in epidemiology from the University of North Carolina at Chapel Hill. I'm originally from the Yakima Valley, grew up in Sunnyside, and then due to the pandemic, sort of moved back to finish my dissertation. And when this position came open, I applied, and I'm really happy to be joining you and really look forward to the work that we can do, COVID related and otherwise.
Welcome.
Welcome.
Dr. Barrios, as a fellow Sunnysider, I want to extend it.
Yes. Yes. Hometown.
Absolutely.
You probably noticed your graphics got a little prettier. That's thanks to Yasmin. So. And then also we have Kelsey Schindler, who is a new public health nurse who is going to be replacing long timer David Miller, who's going to be leaving in June. So I'll let her introduce herself.
Morning, everyone. I'm Kelsey Schindler. I am here I grew up here in the Yakima Valley, born and raised, never left. I've been a nurse for about 4 years and was super excited to see this position open up. So I'm really looking forward to working with the Yakima Health District and all of you.
Welcome.
Welcome.
Welcome. Thank you.
Welcome.
Okay, then we will continue then with Ryan, if you would read off the submitted public comments.
Okay, we have one public comment. It's from Neil Hess, and Neil writes, could the board please clarify the following? What is the current benchmark needed to reach in order to withdraw the mask mandate in Yakima County? Why was a specific figure chosen? What data sets are you using? How often are you checking? Where can the public view the latest data on how close we are to this benchmark? If there is not a target number, why has not one been established and who failed to establish it? When can we expect a benchmark to be set and regularly reported? Thank you for your time.
Thank you, Ryan.
And for any public comment, the board or staff want to address any public comments or answer any questions at any time during the meeting, they're free to do so.
Thank you, Ryan.
I would like to comment on that. Simply saying that the CDC had made their recommendations, had made some changes yesterday, outlining that people who are outside are able to go unmasked. I think that I hope that we will see, even from our statewide at the top that we will see the mask mandates be removed sooner rather than later, especially since we have a vaccine that is so readily available to those who want it.
Thank you, Commissioner. No further comment on that. We will move on to the consent agenda. To approve all items listed with the asterisk are considered routine by the Health Board and will be enacted by one motion. There'll be no separate discussion of these items unless a board member requested, which that item will then be removed from the consent agenda and considered in its normal sequence on the agenda. We have the March 31st Health Board District Board of Health minutes, the April 14, 2021 Health Board special meeting minutes, and payment of accounts payable and payroll issued on March 2021 in the amount of $923,297.28. Is there a motion to approve the consent agenda?
Move to approve the consent agenda.
I'll second that.
Been moved and seconded to approve the consent agenda. Any discussion?
I would only make comment that since these meetings are recorded, that we can get a confirmation from staff that the meeting minutes also include recordings, just in case there is found to be an error in the minutes at a later date, that we can refer to the recording.
Good point. Thank you.
So,
Any other? Go
just
ahead.
for clarification, Commissioner, so the video is on our website. So you're just wanting in the minutes just to mention that they can be found on our website. Is that what you're asking?
Yeah, I would just like that when we're saying that we're approving the meeting minutes, that is also included that we're keeping a recording, so that for any reason, if we looked back and saw that there was an error in the meeting minutes, that they were transcribed, that we did not catch, that the recording is also included. I'm getting a nod, so I'm, yes.
Yep,
So
yep.
okay, so meeting minutes do include recordings, yes. Perfect, thank you for clarifying.
Okay, it's been moved and seconded. Any further discussion? Hearing none. All those in favor?
Aye.
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 All those opposed? Motion passes. Thank you. We'll move on now to item number 6, the board business, and Director Andre Fresco presenting.
Yes, good morning. Thank you to the board, the staff, and certainly to the public. Welcome. I wanted to begin with a COVID-19 update. In full disclosure, I'm not going to go into many specifics because you'll hear more updates from our staff in their reports, but I did want to share an overall view of how COVID-19 continues to affect our county. We are continuing our partnership with the federal government and the state on the FEMA site. That's going quite well. It's a tremendous amount of work, and there are many partners locally who are aiding us in this process: Signal Health and Memorial Hospital, Columbia Safety, the State Fair Board. We are very fortunate to be using a wonderful site for that, and we've had continued meetings with FEMA leadership and the state government on that. We continue to be impressed with their willingness to partner. That has been a very unique circumstance. And again, I've never seen the federal government be as receptive to a local initiative as I have. In fact, I think you'll hear from Nathan in his report the fact that we are setting some standards in Yakima County that are not seen in other parts of the country. So I'm really pleased about that. Our goal continues to be able to serve on a mobile platform people who are hard to reach. And again, you'll hear from others on that. But that has been our sole motive, is to reach people who want to receive the vaccine timely and well. I'd like to also share that we continue to see the impacts of COVID-19 in our community. If I'm not mistaken, we have had 18 deaths since this time last month. So it still is very real. And the state is viewing what's happening statewide as a fourth wave. I would not refer to it that way. If we were to describe that in Yakima County, I would say that that's a third wave, because our first process was so long and so arduous. But nonetheless, we are seeing an increase in cases and an increase in hospitalizations, and you'll hear more on that. But I wanted to share that We continue to be impressed with the resolve of partners and the commitment to vaccinate people wherever we find them. That's been really our #1 priority. And I'll entertain any questions if you have them, although we'll go into more specifics later.
Well, Andre, this is not really a question, more a comment that I would say that we're very appreciative of the fact that we have the mobile option here in Yakima County. It does seem like that is unique, and it has been a great benefit to people throughout the county, north and south, and particularly as we get out to some of the warehouses and farms and those areas where people find it difficult to get to the vaccination site. So that's been a great addition to this effort.
Yes, thank you, Commissioner Lindy. I failed to mention that, and thank you for bringing that up. This mobile platform is very unique to an initiative of this size. And we have been saying for the last 8 months that the growing season would be unique in Yakima County and be representative of what happens throughout Eastern Washington. That fell often on deaf ears. We tried at the federal level and the state level to prepare differently. So we were very strong in our resolve that we would have to come up with a plan. And it's worked out well. And these mobile platforms really have reached people who often don't have their options. So thank you, sir.
I think numbers can speak to that, Andre, and I will say that statewide, but to your credit too, we were all saying that we knew that this was something that we needed to address on a local, we know our people, we know their hesitations, we know what motivates them and makes them feel safe. The Hispanic population in the state of Washington makes up 13% of the population, but only 7%, I think, of the number of vaccines that have been initiated was the most recent figure. But we can be very proud that in Yakima County specifically, our number, I believe most recently was 52% of those being initiating a vaccine in our community, in our county, identified themselves as a Hispanic origin. So that is a big win. And when you say that we're setting the standard, I agree. And I think it's something that we can be very proud of as a community for knowing how we can keep our people safe and providing them the resources that we know they want, the way that we know they're comfortable receiving them.
Thank you, Commissioner.
Let me also say, Andre, that, from early on in the many conversations that the electeds, myself included, and the health district communicated with the governor's office, the urgency of understanding what a unique community we have, and therefore, the different needs and areas of focus and help that we needed that for so long really did not come through. And so thank you for staying the course and continuing to forge a path forward to make sure that we had what we needed in this community.
Thank you, Mayor Byers. And I do also want to share that we have pop-up vaccination clinics and sign-up registration events throughout our cities as well. So it's worked out quite well in terms of trying to be broad and certainly fair in this approach. If it's okay, I'll move on to the second board agenda, which was mask wearing. Commissioner McKinney, you wanted to discuss mask wearing for kindergarten through 12th grade for physical activity outdoors. If I may, you did bring up also the fact that the CDC has announced changes to outdoor activities. I'd like to just share that we are reviewing that and certainly working with the state on that. We anticipate that the state will come out with some recommendations as well. We're waiting on those. But again, that was a board item that you wish to have added to the agenda. So I'd certainly like to hear from you, ma'am.
Yes, certainly. So I think we're able to see that our children, thankfully, have been particularly and thankfully, gratefully, not particularly impacted by COVID. They don't end up in the hospital. They are not known to be carriers. We've got excellent evidence of that through the data that Ryan has supplied to us, showing that out of all the students and staff who've been going back at school since the beginning of the school year, which of course those numbers have been increasing in the number of students and staff going back most recently the last couple months, we still only have, I believe the latest number, Ryan, was 20 20 cases of known transmission to have occurred at school. And my request to bring this up is actually specifically resulting from, of course, some frustrated parents seeing that their young children who, as we know, are not impacted by COVID and not known to be spreading COVID are being required to run up and down the fields wearing masks. And one issue that we see is that if anyone has looked at the front page of the newspaper, and we see our high school athletes being photographed, playing on the soccer field, doing these wonderful things that encourages them to grow and be healthy. The masks are down around their necks. They're not being worn properly. Especially noted of the younger children. They are, I can speak for my own family, the younger they are, the more difficult it is to have them actually wear the masks properly. And I think it comes down to the fact that mask usage is known to help protect against the spread of particulates if used correctly. And so those best use practices for a mask are that it covers your nose and mouth, that you are not frequently touching it, that if it becomes soiled or saturated with sweat or saliva, that it is replaced and washed frequently if it is a cloth mask. I can tell you that is not occurring in our youth. None of the proper mask usage is occurring on our fields, not because the kids either, from 4 years old or 18-year-olds quite capable. It's simply intense athletic play. I also see that we found ways to allow adult athletes who seem to be compensated for playing sports be allowed to not wear masks, even though they are much more high risk for carrying COVID and spreading COVID. So what I would like to see in our community, and specifically from this health board, is that we make a recommendation that states that any children who are ages 0 to high school senior, be it 18, 19 years old, that we remove our recommendation that they wear masks when in intense physical play. And I would say whether or not that be private or public sponsored organized sports, out at recess and out in public spaces that I think fresh air, as we know, out in the community, the CDC has just changed our guidelines. These kids need to take off the masks. And so my motion is that we recommend that children ages 0 to 18 in Yakima County not be required to wear masks in public outdoors and in extreme exercise play during private and public sporting events.
Can I ask for a clarification? You're saying they don't need to wear masks outdoors and or during?
So anytime
Just
they're
like it.
outdoors and they're, yes, Dr. Cleary, outdoors.
Okay.
No masks for children outdoors.
Well, just to kind of comment on some of your early comments on that, children are affected by COVID. There have been 3.7 million cases of children testing positive for COVID. Over 300,000 children have been hospitalized. There are 43 states who report their deaths by age. 40 of them have had children die. The number of children that are infected by COVID has actually been increasing, and it's pretty obvious that they are now the reservoir for COVID, and particularly the variants. 13.7% of cases in the nation are amongst children, but in Washington it's higher. And in Yakima, we've had over 20% of our cases of testing positive in children. So they are becoming the reservoir and potentially the ones that spread to the rest of the population. The science is that adolescents have the same ability to spread disease and infect others as adults. So they are not safer to be around. And the CDC guidelines, if we follow those, actually make a point of discussing not using those guidelines in communities where there's a moderate, substantial, or high risk of community transmission. Not using it when the settings have a high percentage of unvaccinated people, which includes children, and in activities where there's a extreme exertion, shouting, physical exertion, and the ability to spread particulates more easily. The CDC has lessened its guidelines, has opened some opportunities for children to play without masks, and I think we should follow the guidelines rather than making up something new. Children actually do quite well with masks, and I know there are times when they get dirty and things like that, but actually they seem to have a much better tolerance for wearing masks than most adults. And there are other good sources of recommendations on using masks amongst children from the American Academy of Pediatrics, from organizations like childrenhealth.org. I think it would be better to follow set guidelines rather than make up a statement of our own that's inaccurate.
Chair Anderson, put just a point of order that we've had a motion and we would need a second for discussion.
Yeah, I was just gonna
Thank you.
interject that. Thank you, Ryan.
Sure.
There has been a motion. Is there a second on the motion?
I would second the motion.
It's been moved and seconded can you clarify again, Commissioner McKinney, on your motion?
My motion is that the Health Board of Yakima recommends that children ages 0 to 18, or if they're still in high school, are not required to wear masks when outdoors and when in extreme physical play.
Thank you. Now we'll have formal discussion. Thank you. Thank you, Dr. Cleary and Dr. Atterbury on those 2 points.
I won't repeat what I tried to say.
Okay.
But I do think it's important that we look at the motions that we're making as a Department of Public Health and really assess whether we're doing something positive or negative towards the pandemic. We've had a number of motions that essentially are counterproductive, are increasing exposure, increasing interactions between people, increasing all the things that we know lead to the spread of disease. Children may not end up hospitalized as much, but they do end up hospitalized. They do die from COVID, and adults certainly do. And when our metrics are still on the borderline, and we've had so much concern about the results of these metrics, about being able to maintain phase 3, to move on to other phases, as the citizen comment was appropriate, when are we going to be able to get rid of the masks and the regulations? I think it's terribly counterproductive for a health department to be recommending things that we know are going to prolong the pandemic, increase the spread for a trivial benefit for a minority of the population, which is not as vulnerable to the severe and even fatal consequences of the disease.
Dr. Clear, we're going to return to normalcy. And I think when you talk about vaccinated people and what the public health, the public has the right to choose. Parents have the right to send their children to the soccer field or down the ski slopes. And there is risk associated with everything we do as adults and as parents when we send our children off to do something. If someone is concerned about contracting COVID or their child contracting COVID, then they have the opportunity to not send their child onto the soccer field. There are many other reasons why physical activity can be dangerous or harmful to children. And yet parents every day and students every day make the decision to go out on the field and do it. It's a choice. We need to allow them the opportunity to make the choice. When we talk about our vaccinations and eliminating the spread of COVID, we are never going to eliminate the spread of COVID. It is a virus that is here to stay. And in Yakima County, we're at about 32% of the people have been vaccinated. And as we all know, and I'm sure will be discussed later, there are thousands of appointments that are available that go unfilled in Yakima County to get the vaccine. We are going to return back to normal, whether or not we have people get vaccinated at 40% or 70%, because it's a choice. You cannot save people from something that they don't want you to save them from. It's time we return to personal choice.
Well, I would have to point out that there are a lot of things that don't allow personal choice. Seatbelt use, wearing helmets. Children do need to do things that are protective for them, and adults need to make intelligent decisions like adults and protect the children. You can't just say everybody has the choice to do whatever they want when it endangers the rest of the community. That's
So
not
you're
a
saying
part of
parent
public
who would
health.
a parent who would choose to send their child on a soccer field at 6 years old without a mask is not making an intelligent choice, and you're going to make it for them.
No, the way I see it is, for example, if I had a 6-year-old child and I wanted him to participate in playing soccer, well, I would be more willing to do that if we were following the guidelines. I would be more willing to do that if the kids were wearing their mask properly. And I think it's a responsibility of the parents and the coaches and the adults there to tell the kids to wear their mask properly, because that's when they are effective. So to say, let's get rid of the masks, I just don't agree with that. I think you're not concerned about the people that are still, have reservations about wanting to go back to normal, because it's not normal yet.
If I could, I'm sorry, if I could interject just a little bit. One thing I think I would like to add is that we're having this discussion about spread of COVID. One thing that's being left out, we're talking about volume of infection, but I think we can't ignore the severity of infection. That is an issue. I would agree the fact that, yeah, I mean, we want to keep people safe, but there is also a balancing of risk. I guess one thing I would like to ask is, it might have been Dr. Cleary that said that there were some guidelines that have already been put out regarding circumstances where kids don't have to wear masks. And I'm just kind of wondering what the CDC has said on that. I mean, they've already stated about outdoor, if you're vaccinated, that you don't have to wear masks, whether you're alone or in small groups. I'm wondering what it is they have said about school children and mask wearing, if they've loosened some of that, their recommendations.
Commissioner Lindy, I'm not aware of loosening of restrictions and mask wearing for children during sports. I think that one of the things that the state is having to respond to is this new change to the CDC guidelines. And we specifically are encouraging them to look at this very issue of school sports. We're in the spring. We do have more sports activities, and I think that there is a question of what the state intends to do. And I think the CDC also needs to be much more clear about sports activities, because you do have more exertion in those activities and you do have closer contact, which is one of the issues that is not being addressed.
Okay, thank you. And I guess I would reiterate that from, the statistics from our health district, but also this health districts across the state, when we're looking at COVID infection among students and among staff, one thing we do know is that there have been 0 deaths due to those cases and 0 hospitalizations overnight as a result of those infections among students or staff in the entire state of Washington, according to the latest figures I've seen.
Sure. Thank you, Commissioner, for bringing that up. I'd like to address one thing. I'm hoping that Ryan or Sean can discuss this, but we do have a circumstance where we are seeing an increase in sports-related transmission, concerns around that, and that is impacting schools. The reality is that I know that this is difficult in terms of personal health choices, but the reality is that a person who has COVID can spread COVID. And so we are seeing transmission. We continue to see an increase in that kind of transmission. And it is concerning because it's not just something that someone receives. It's not as if you simply are infected by COVID and you may or may not have a health impact. You are then able to transmit to others, which is why this becomes a community concern. Ryan,
Dr. Frisco, how often are people, what would you say their ability to be vaccinated is right now? For the people who want to be vaccinated, is the vaccine readily available in our community?
Yes, definitely.
So those people who want to be protected from catching the virus have had the opportunity to do so readily. You would state that?
I would. But I would also countermand that part of our responsibility in public health is to care for those even who aren't protecting themselves. That's why the community health is so important, because the choices, the individual choices that people make to protect themselves and protect others protects everyone. And I have to be very direct about the fact that we are not out of the woods in terms of COVID. And one of the reasons is because there are many people who are hesitant to receive the vaccine or choosing not to receive the vaccine. So I would be far more comfortable in terms of the consequences of the choices people make if we had a much higher vaccination rate, but we do not.
I would
Our
like to have,
vaccination rate is particularly low amongst the children and adolescents.
I would like to have the opportunity for others on the board to make their comments.
Sure.
Thank you.
One thing, I know that the international studies, both in Australia and Japan, indicated that a 30 to 34 percentage less transmission rate in outdoor as compared to indoor venues. Those are national studies put on by their governments, Dr. Cleary. My question for you would be, if we're letting people go outside and they're taking off their mask outside, aren't we lessening the transmission rate? Because where they're most likely transmitting or carrying it, as you're telling me, is indoors, not outdoors. And so getting them outdoors, getting them active, that seems to be in the best interest of the public.
Other board members?
Go ahead, Nalia.
Well, I just want to say that on Sunday we received some school data, and there is transmission and there's things going on because there were 4 athletic teams that have been quarantined. And I think this motion is very specific to a certain age group of people, and us as a Board of Health need to be thinking about the public health of the whole community, of everybody in Yakima County and our whole jurisdiction, not just a specific age group.
Commissioner Anderson, I'm hoping that I can address another issue related to this around the law and also the State Department of Health guidelines, if you will, at the conclusion of comments, please.
Okay. Any other comments from board members?
Yes, I'd like to speak. Thank you. I'm kind of waiting and listening. So, I understand Commissioner McKinney's desire to move forward with this. I think it's been a point of frustration for a lot of people in the community, especially in response to Mr. Huff's public comments. A lot of people have that question. One of the things, but I remember we talked about the last time we met as a Board of Health, is that this is a situation we are not going to cure COVID. We are not going to eradicate it. We are going to learn to manage it and to live with it. And, because that's the reality. Like any other infectious thing that comes into our community, we really don't eradicate. We learn to manage it well and to live with it. So I think that we need to continue looking at it from that perspective as we make decisions and move forward. I think that a lot of the increase that we're seeing in testing of youth is because of youth sports. I don't think, I may be wrong, my perception may be incorrect, but my perception is as we're testing more, we're finding more, we're actively testing them because they're actually out and engaged in doing. So I think that would be a normal expectation, that as we test them, we would find that. And finding somebody who has COVID and somebody who is actually sick from it are 2 different things. And that's part of the management point of view we have to have as we move forward in this, together, is that recognizing it is probably far more widespread in terms of carriers than we are even aware. But the most critical point of information is how many, not how many positives, but how many people are, actually sick or hospitalized, and what do we do in those situations most effectively. But I also agree that we are still under a state mandate of types. My recommendation would be, as we consider this motion, or as we consider moving forward with we as a body would continue to have those conversations and put the kind of pressure on the state to evaluate those things, as we move forward in terms of what can we expect in the future, and what can we do because we're not getting eradicated right now. And the state needs to realize that too, that we have to learn, how to move forward as a community and how to move forward as a state, managing it in the best way that we can. Thank you.
Thank you. Any further comment? If not, we will move on to, and I will ask for for the vote. All those in favor?
Pardon me,
Go
Commissioner
ahead.
Anderson.
Oh, I'm sorry. Go ahead, Andre.
If you don't mind, and again, this is out of not only respect to the board, but also protection of both the board and the health district. We are currently under state guidelines, and so I welcome these robust discussions. I know that these are complex, and many of them cause great frustrations in the community. But I do want to share that again, we follow the very simple concept that we can be more restrictive as a health district, but it's often difficult to be less restrictive. So we move into a very uncomfortable position where if the board chooses to support a motion that reduces guidelines that are state guidelines under the direct authority of the governor and emergency powers, that becomes a legal problem for us. So I share that in candor. I welcome James Elliott's perspective, but I'm not positioning the board, but I do want to share with you that the board taking up a motion that sets the health district to be in violation of state law becomes problematic.
Thank you very much. We've had a lot of discussion back and forth, and so I'm going to call for the, go ahead. Go ahead.
I'm sorry, Commissioner. And before we take the vote, I will let the vote go ahead, but I'm going to, depending on the outcome of the vote, I would recommend that if the vote is unfavorable, that we actually change this and actually petition the state. We ask the board to petition the state to make these changes. That would be my thought. But with that, I'll let the vote go forward.
Thank you. Okay, there's been a motion and a lot of discussion. If all those in favor, say aye.
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 All those opposed?
Aye.
Okay.
So there's Brian, I count 2-2.
Okay. I can
I
do,
think there were 3 nays.
3 nays. Okay, thank you. I missed that.
would you like me to do?
Yes.
Okay. Okay, so the motion is to recommend children ages 0 through 18 or still in high school not be required to wear masks while outdoors when in extreme physical activity. Okay, so if you're in favor, please say aye. If you're not in favor, please say no.
Can we have a roll call vote, please? I think that'll make it.
Let's do a roll call.
Yep, that's what I'm doing. Okay, Commissioner McKinney,
Aye.
Commissioner Lindy,
Nay.
Mayor Byers,
Nay.
Nyla Duval,
No.
Dr. Atterbury,
Aye.
Dr. Cleary,
Nay.
and Chair Anderson.
No.
Okay, so the vote is 2-5.
Okay, thank you much.
So with that point, what I would like to do then is I actually would like to ask the board to recommend, well, I would like the board to petition this to make this change to the guidelines.
Is that a motion, Commissioner Ledon?
Yes, I would move to ask the Board of Health to petition the state Department of Health to make these changes to the guideline as previously requested by Commissioner McKinney.
I would second the motion.
Been moved and seconded to ask the health district, Yakima Health District, to petition the state to change the guidelines for wearing of masks in the outdoors. If I need more clarification for language, please interject.
Commissioner Anderson, if I may, I believe that the motion was for the Yakima Health District Board to petition the state. I believe that's what Commissioner Lindy said.
Okay, thank you for the correction.
Thank you.
Yes, so we petition the state.
Okay. Ryan, do you have that at hand there so you can read it to us?
Yes. So the new motion by Commissioner Lindy is to ask the Board of Health to petition the State Department of Health to make changes as stated in the previous motion, which was to recommend children ages 0 to 18 or still in high school not be required to wear masks while outdoors when in extreme physical activity. So Dr. Clary, or did we have a second in discussion? Or?
We had a second, Dr.
Yeah, I seconded.
Mayor Byers did.
Okay, so we're ready to vote. Okay. Dr. Clary.
Is there any discussion on this?
Yeah, we need discussion.
So I'm not sure you have the wording quite right there, Ryan, because it sounded like you have when outdoors or outdoors when engaged in physical activity. And that was the point that I'd asked Commissioner McKinney to clarify. Is it only when in physical activity or is it all times outdoors? And I think she had used the term and.
So Commissioner Lindy, you made the motion. Is that your interpretation?
Well, my understanding was that it was and or, that it was outdoors, whether they're outdoors, whether or not they're in vigorous physical activity, it was
just outdoors.
And do we actually want to hand them the terminology, or do we want them to just update the guidelines and create guidelines for youth sports and mask wearing?
Well, my thought is that we make that request, that they take into consideration our request.
Well, it just seems to me if adults who've been vaccinated can have the freedom of not wearing a mask, that certainly our children who are not even eligible to receive a vaccine should similarly enjoy that freedom.
So I seconded the motion, and the reason I did is because if we want to move forward at asking the state to look at those kinds of considerations, and we as a Board of Health need to make that request. And, we can make the same arguments on both sides at this particular point in time as we made with the initial motion. The initial motion was for us to make that decision. We legally are in a position where we cannot do that, but we can legally make that recommendation and, and talk to the state Board of Health and the governor's office about that. And I think that's what the motion is. Is that correct, Mr. Lindy?
That is correct.
Thank you.
Thank you for the clarification. Okay, any further comment?
I just want to say that I just feel like it's just so counterproductive to go against state recommendations and CDC guidelines. They do say adults can gather out and outdoors, but it still has to be in small groups. So it's not completely open. And like I just said, it's very counterproductive. I think we should just be in lockstep with the guidance. So that's just my opinion. I think we would be better off that way.
Thank you.
Washington is a sovereign state in a nation that's a federal republic. It is not a kingdom. So I don't like the term lockstep in any way, shape, or form. I think we should have the right to choose what we choose to do with our own health in the very similar way that we have the right to choose whether we get vaccinations, whether we take part in taking medications and recommendations from our doctors or any other health choice we have. So I would just say we're making a recommendation to help push the state, to help educate the state, and to maybe suggest to them that some of the rules that are being enforced upon us right now are infringing on our freedoms. And it's those freedoms that we're defending. So I would stand and defend those freedoms every single day. And I would hope this board would too.
And I'm not saying that I'm saying recommendations. People still have the choice to make on their own. So I'm not saying that it's an obligation. It's still a recommendation. It's still guidance.
No, it's not. I can't send my son or daughter out on the field without requiring them to wear a mask, or they do not get to participate. So we are required right now, and businesses right now who do not enforce these mandates are under duress, and they will lose their business license and their ability to operate. So we are pressing against the state to allow people to make personal choices. And to Director Fresco's comments, sometimes people make decisions that are contrary to what's best for the public health. That is a decision that people are making inside of a health office when we have had the opportunity now for months and months for people to choose to get a vaccine. At the end of the day, if they do not choose to get it, and the number and the density that we are saying that we need to get herd immunity from the vaccine, which it's important to note this immunity from actually having and recovered from COVID, we cannot compel people to do something that a small group of people believes is better for them. Again, you cannot save people from something that they don't want to be saved from. It is not dissimilar from putting taxes on Flaming Hot Cheetos and Pepsi and all the things that we do to try to discourage people from making poor health habits as perceived by public health officials. But at the end of the day, people buy Pepsi, they buy Coca-Cola, they buy all these things. They don't exercise. They do things that are contrary to what public health officials would recommend in order to ensure their safety and health. They do it all the time. And at the end of the day, it's a choice.
I just want to support Dr. Atterbury's statements because we are a nation of liberty and choice. I don't think that we can vagrantly just disregard laws, but we have a voice and we can use that voice, and we as a Board of Health can let the state know what our position is, what we would like to see happen. We are still overall, a nation that is governed, by the people, for the people. And so while we want to be able to have everybody agree with us in every decision we make, that simply is not what happens in our nation. It's not how we govern ourselves. So I think it's a strong, from my thinking, it would be a strong position of the Board of Health to move ahead to bring this conversation to the state level. In terms of, we are ready for this to be changed, and you need to look at areas, you need to look at numbers, you need to look at the reality of choice, look at all of those things, and instead of just mandating, let us be part of that conversation, let us be part of that decision.
Mr. Anderson, I'd like to make a point of, I get some direction from the board after the vote is taken. So I'm just hoping I can have some time after the vote has been taken. Thank you.
Any further comment?
I would just simply add that, we had a comment at a recent health board saying that, we don't allow people to drive around at 150 miles an hour, and that is true. But also we do not mandate that people drive around at 5 miles an hour. We try to balance and manage risks, and this is one of those cases. And we're at this point, we're not trying to do anything that's illegal, but we are petitioning the state government to balance risks and make a change here. And with that, if there are no other comments, I would call for the question.
Okay, the question has been called for. Ryan, would you do a poll, please?
Yes. All right. So the motion that you're voting on is the Board of Health petition the State Department of Health to make changes as stated in the previous motion. If you are in favor of the motion, please state aye. If not, state no. Dr. Cleary.
Nay.
Commissioner McKinney.
Aye.
Commissioner Lindy.
Aye.
Mayor Byers.
Aye.
Nyla Duell.
No.
Dr. Atterbury.
Aye.
And Commissioner Anderson.
Aye.
Okay, so the vote is 5-2.
Thank you. Go ahead, Andre, with your comments.
Yes, thank you. I appreciate, again, the robust conversation. This is very helpful to us because, again, having a position that the health district or the Board of Health has to convey to the state is more than appropriate. Thank you. I did, again, want to share the distinction that we make in public health between personal health and community health. And again, one of the reasons that we are so pro-masking is that in a community where many people have neither received the vaccine or choose not to receive the vaccine, wearing masks is one of those commitments that people can make to ensure their own safety and the safety of others. So again, I think you're correct that we will be living with COVID for many months to come. And again, we will continue to share best practices with you, which we feel protects the entire community.
Thank you.
Thank
It's a
you.
good point, Dr. Fresco, and I know we don't want to take up too much time, but I would like to move that we have a topic added to our next agenda, and that is our current recommendation for a mask mandate in Yakima County. Thank you for bringing that up, Dr. Fresco.
Okay. All right, are we ready to move forward then?
Okay. Well, thank you. The last piece for me is House Bill 1152, which is again the bill that discusses the composition of boards. That was since our last regular meeting that was adopted by the legislature. I wanted to share that the information that we have, the most recent information, is part of our board packet. It is the actual legislation that has been sent to the governor's office. And so I just wanted to share with you what I understand about that process, and certainly would like to hear from all of you. My understanding is that it's now before the governor. I believe that he received that this week. My understanding is that he has 20 days. And again, I'm not a student of the legislative history here, but my understanding is it's 20 days excluding Sundays for him to make a decision. My understanding is that he could sign it now, or he could veto it, or he could make deletions to different proposals in that. I would highly doubt that he would veto it. That's just my opinion being shared. But it's unclear to me whether there are going to be changes at this point. There have been some additions to it that were real-time additions that were a surprise to many, which was the inclusion again of comprehensive support districts, comprehensive health districts, the idea of having staff who would be available to support what happens in different regions within the state. It's unclear to me how that will look. It's unclear to me how that will end up becoming official, but that is now a part of this House Bill 1152. And so I don't think that we will have an official document until the governor is finished signing that. And I would anticipate that we should have something before our May 12th meeting, but not until then. That does have an impact on the decisions that the board is making, and certainly around the resolution, and also discussions around the county commissioner's ordinance. So I just wanted to share that with you. Certainly look forward.
Question, Andre, maybe this is better served for James Elliott, but does the governor in this state have line item veto capability?
He does. My understanding, Dr. Atterbury, is that he can line item veto sections, but not necessarily sentences. I don't study the governor's powers very often. It's not an area, but my understanding is it's different from the federals. It is a line item veto, but it allows him to make deletions related to sections as a whole. If you see the current proposal, or excuse me, the one that was passed on 1152, there are actually, I think there's 8 sections, oh, excuse me, 9, the very last one. So the sections are marked in bold by their numbers.
Got it.
So I have a question about it, and I know that this isn't final, but I'm trying, I read through it a couple times, and I'm trying to try myself to clarify exactly what it is saying. And it's saying that a board of health that has been established prior to July of 2021 can remain as it is that correct? And that any new board established beyond that point by July of 2022 needs to include all of the inclusions that they put in there? Or is that incorrect? Does that mean every board of health by July of 2022 has to change its makeup, so to speak, to comply with this?
If that question is for me,
Yes.
Mayor Byers. I think there can be some discussion still about that to one degree, but I will tell you that based on the way Section 9 is written about the effect of this bill, if you turn to page 18, and I don't know if Victoria, you can get there on the PowerPoint. Page 18 identifies a new section, Section 9, that identifies sections 3 through 6 take effect July 1st, 2022. So that's the very last page of the bill. I'm sorry, I'm speaking before it's on the screen. So this identifies that sections 3 through 6 take effect on July 1st, 2022. The other sections, which are 1, 2, 7, and 8, those, pursuant to how this is currently written, those take effect as soon as this thing goes in and is signed by the governor, or after, obviously. If his line item veto comes through on anything, I'd have to look at it, but I think a super majority is required by the legislature to overturn that. But I will be honest with this board, governmental politics at the state level is not something I study very often, but I think I remember that. But sections 1, 2, 7, 8, and 9, Mayor Byers, would go into effect immediately by the way I read this bill as it currently reads.
Thank you.
Mr. Elliott, I think, and I could be wrong, but I believe that laws go into effect 90 days after the end of session. So that may be the only distinction.
And that may be, I apologize to this board, studying up on effectiveness of bills and dates and governor and legislative override. Not an area I study very often. If this board wants me to put my time and effort trying to do that, I will, but I haven't for preparation for this.
Mayor Byers, there is one clarification I'd like to add. I think that there is room for some of those discussions, but I think there also is a component of this House bill which indicates that there has to end up, at the end of the day, has to end up being an equal number of electeds and non-electeds. So
that is true, Director Fresco, from my initial review, and it will, basically, we will have to reform the board because it states that the 3 county commissioners appoint 3 members as outlined. So there is much to discuss, but I think it's futile at this point because we don't necessarily know if it'll be signed and what might be stricken. So I think it would probably be prudent for us to table this until the next meeting to see what occurs.
yes, ma'am.
Before we do that, I just wanted to ask you, Commissioner McKinney, where you came to the interpretation that the composition of the board would change to 6 people, and if you had a timeline on or what your ideas were.
Sure, I'm not able to see in the small print right now on my screen, but maybe Mr. Elliott can. From my initial review of this, you're not allowed. We have, as you know, right now, yourself and Dr. Byers, who are representing municipalities. And we know we're going to have to make some changes to the constitution of this board because we cannot have elected officials have a majority. It also describes that people who are citizen members at large have to be appointed that represent a certain targeted point of people. So there's a big long list that describes whether or not they're in public health, but that can be anything from a massage therapist to a dentist. There is a line item for people who are consumers of health. There's a line item for people. I know that it even says with preference for someone in the armed forces, whether current, retired, there's a whole gamut of it. So we do know that there will have to be some kind of restructuring of this board. You can have, it does state other elected officials, but for each elected official, you would not have, you would have to have subsequently those citizens at large so that there was an even number. There's also something in here that I'm sure Mr. Elliott is looking at that discusses the appointment of a member from a local tribe or nation. So there's a lot to digest here. I think one thing we know is that if it does go through, we will be talking about this because there will be some sort of reconstitution of this board.
I think part of the reconstitution of the board, as I was reading through it, is that, first of all, it takes it to an even number board rather than an odd number board, which places us in the position of multiple tied votes, not just if somebody is absent. I think that is something to look at. And also, it says that the Board of Health itself will elect a chair annually. So those things are different and varying from what the ordinances are right now. So there really are a lot of things that are going to have to be looked at. And I agree with you, Commissioner McKinney, that we really can't do any of this effectively until we know exactly what is going to pass. So I would agree with tabling this.
Okay, back to Commissioner McKinney. You recommended tabling this. Is that a motion?
Yes, I'll make a motion that we have this appear on our next agenda for discussion.
I will second.
Been moved and seconded to table the further discussion of HB 1152 until our next board meeting. Any discussion?
I agree. It's the only prudent thing to do. To table it.
Other comments? Hearing none, all those in favor? Ryan, would you take a poll, please?
Yes. So the motion is to table this discussion of House Bill 1152 until the next meeting. All those in favor, please state aye. All not in favor, state no. Dr. Cleary.
Aye.
Commissioner McKinney.
Aye.
Commissioner Lindy.
Aye.
Mayor Byers.
Aye.
Nyla Duval.
Aye.
Dr. Atterbury.
Aye.
And Chair Anderson.
Aye.
And the vote is 7-0.
Thank you. I just wanted to clarify, has everybody received a copy of this just to make sure? Because I know that there's been reiterations of this thing over time here while it was going through legislature. So make sure that you have the latest copy, the one that passed out and is on the governor's desk. So we please read it and make notes, questions as we go, so we can have maybe a more defined discussion at our next meeting. And hopefully
I would ask if Ryan or Andre can distribute as soon as we have signature from the governor or approval, the final version rather than the non-edited version, I guess.
Right. Yeah, I agree with that, Doctor. And that could, as Mr. Fresco said, it could be today, it could be next week, it could be 20 days from now. So we may be pushing this off again until we do have that final, because we don't know if there's going to be any changes by the governor on it. All right. Thank you much for that vote on that, and it will be tabled until at least our next meeting.
Thank you. That's all for me, Commissioner Anderson. Thank you for the discussion.
Thank you. We are at 10 o'clock. So let's begin with financial report from Mr. Porter.
Morning. I'll go through this quickly. So if there's any questions, please feel free to stop me and ask a question. I'm going to move as fast as I possibly can. So for the month of March, we had a gain in revenue about 89,000, bringing our loss for the year down to approximately 220,000. Our allocated budget through March is 1.8 million, and our total for revenue and our actuals are coming in at closer to 2.4 million. And for expenditures, our allocated budget was 1.8, closer to almost $2 million, and our actual expenditures coming through is $2.6 million. We are on track to go over our expenditures for the year. So we will need a budget amendment, probably late summer, early fall. We'll probably be looking at that come September, August through October, probably in the third quarter, we'll be looking at that.
Jake,
questions?
Favor, please, if I may, I appreciate you moving quickly, but can we track this on our screen as well?
Oh, yeah, I'm sorry. Next page, please. Yes, there we are. So, excuse me. Sorry, I was looking at our pictures. So allocated budget 1.8 and almost 2 million for revenue and expenditures. Total actuals 2.3, closer to 2.4 million for revenue and 2.6 for expenditures. Sorry about that. Is there any questions regarding this? Next page, please. I would just want to point out two things on here. Is our developmental disabilities up in our revenue section. You can see that for the monthly piece, we're over, as well as down in provider services, the expenditure section. The second to last line on provider services DD, we are up over that on our monthly budget. That has to do with a rate increase that we've done for all of our DD providers. They've been struggling the past year, and a rate adjustment was able to help them out with that. We worked with DSHS on that, and that was from the state. So that's been very helpful. And monthly, we speak through this, it's another COVID month. A lot of our revenue and expenditures are being driven by COVID. Is there any questions? Next page, please. So last year we had $300,000 we received that we did from 2020 that we're using this year, and you'll see that last one on the very last line. State funding from last year kind of evens out our annual loss on revenue. Any questions about that piece? Next page, please. For our programs, again, COVID dominated. We're starting to see a rebound in EH. Scroll down just a little bit to the blue section. Our EH programs are picking up, starting to pick up in March and April. They can certainly to attest to that. As you can see, the big loss for the DOE well drilling inspections, we'll get a quarterly bill from DOH or Department of Ecology that will help with those expenses. Questions? Next page, please. And this is just the wrap up of our programs. Is there nothing to really note here? Is there any questions? Thank you. Last page, or second to last page, is our March COVID spending. We spent $391,000. This is fairly consistent with what we've done. So just keep in mind, this is not including any of the mass vaccination site costs. There will be some in April, but they won't be an incredible amount because a lot of the procurement is not passing through us. So that will help with keeping our expenditures down. Any questions regarding COVID? All right, last sheet, please. This is our cash flow for the month. As you can see, as we tend to get a payment in January and July from Department of Health, and so we have an uptick in revenue in those months, or in cash, and we start to see a kind of a small decline until we hit July again, and there'll be another uptick. Any questions? That wraps up my report. Thank you.
Thank you much, Chase. Is there a motion to approve the financial report for the month of March 2021?
Motion to approve financial report.
I'll second that.
It's been moved and seconded to approve the financial report for the month of March 2021. Any discussion? Hearing none. Ryan, would you please take a poll?
Yes. All right. To approve the financials, Dr. Cleary.
Aye.
Commissioner McKinney,
Aye.
Commissioner Lindy,
Aye.
Mayor Byers,
Yes.
Nyla Duval,
Yes.
Dr. Atterbury,
Aye.
and Chair Anderson.
Yes. Thank you much. Appreciate it.
7-0.
Thank you.
We'll next move to the Chief Operating Officer, Mr. Ryan.
All right. So there's three issues that I want to discuss and just give the board awareness. Actually, first of all, before I start that, if there's any guests or press, if you could identify yourself in the chat box or and your affiliations if you have not already done that. So the first issue is schools. Sean McGee and myself have been working with several high schools on graduations. We are also working with the county GIS department to come out with a schematic. Hopefully that's going to be today. A layout of Zuffel Stadium is what we're using to show how many people can fit in the stadium, where the stage will be, where the graduates will be on the field. And then the guidelines allow for pods, 100 square foot pods, up to 6 people per pod. And so GIS is laying out those pods so we can see what the maximum capacity is. We're working with schools to try to get a maximum capacity for spectators and still fall under the guidelines. The schematic will be sent to all schools so they can kind of use that as a guide for their own stadiums if they wish to do it. A couple of schools are looking into using, besides Yakima School District schools, a couple other high schools are looking into Zephyr Stadium too, just because that is the largest facility where we can fit the most number of spectators. The Sun Dome is indoors, so it is limited on the number of people. So Zephyr Stadium would hold more people. So we do continue to work with several organizers throughout the county for graduations. Any questions on that before I move forward on schools?
Can I just make a quick comment, Orion? I just want to thank you and Sean. This stemmed from a lot of questions, and we were in a meeting with a local group that was trying to put on a graduation and came up in conversation, the frustration, and I had asked whether or not we could put together some kind of a diagram, and we're really happy that the county GIS is able to help out. And I just want to thank Sean again and you, Ryan, for always trying to find a way to put these parents at ease as they try to mark these really great occasions for their students. Even in spite of a pandemic, they still want to see those students graduate and walk across, and I thank you for that.
Absolutely, thank you. And we look forward to continuing to work with the high schools. On phase updates for the Safe Start, the next report will come out on May 3rd, and any movement takes effect on Friday, May 7th. We did find out that the case rate date range that they're going to be using is April 10th through April 23rd. The reason for this date range is because there is an 8-day lag. So Saturday, this coming Saturday is when they'll pull the data. So it's going 8 days back would be the 23rd. For hospitalization rate, the date range is April 14th through April 20th. This is a little bit further back because there's 11-day lag on hospitalizations. And so we will find out officially on May 3rd about the phase that Yakima County is in. Any questions on phases?
Are we going to have a chance to talk about that and what the situation, because later?
Yes.
The situation report continues to change and the data has been unclear. So are we going to talk about that later?
Yeah, if Melissa, if you can briefly just tell, Melissa is corresponding, communicating with DOH on a daily basis on every single hospitalization. So Melissa, you want to just real quickly?
Yeah, the metrics are going to be from the 14th to the 20th of April. I'm going through right now and working with the hospitals to confirm actual COVID diagnosis for admission or discharge diagnosis. We were able to figure out from the Department of Health that it's pulling from 3 different variables. One of them is based on case investigators when they call and interview these folks. So I was able to find some where the patient said they were hospitalized, but in fact, it was just an emergency department visit. So those have been cleared up and reconciled. And I'm going through every single one of these. And at this moment, we currently stand at 13 for that time frame.
So I do have a couple questions about it, because when I scroll through and I keep track of the situation reports, I'm wondering, because if you go, say, for example, looking at the date on the 14th, we had 19, and then in the subsequent day on the 15th, we had 17, so that was a -2. But what I'm understanding, I believe, is that that's actually just a net number, and so we don't know how many, as a health board or whoever is receiving the situation report, what is the actual number of hospital admissions and discharges. So I'm wondering if we can have clarity on that. And then I also noted on the 19th, on the 16th, there were 13 people in the hospital. And the next day on the 19th, there were 20, but it indicated that that was a +9. And obviously that was 7. So I'm just curious if we can get clarity on that, because the situation report doesn't seem to be accurate on that. The other information that I had requested was regarding breakthroughs. So I'm wondering if we're talking to the State Department of Health to see if breakthrough cases are impacting our numbers, which I believe that they should not. And then if we're potentially asking them to give us a greater indication of what our population is, as we know we do, as much discussed, have an increased migrant increase for farming right now. Our population has gone up much higher than the 258,200. So I'm wondering if we're addressing that with the State Department of Health to take into account that we do actually have, although temporary, a higher population right now. So those are the questions that I have most specifically. And then I think I also asked for numbers regarding any cases from assisted living centers when people are obviously, they're not leaving, they're there. And so I don't think that if there's an outbreak and people are testing positive, whether or not that's actually a true indication of community spread. So those numbers should also be deducted. And then lastly, we did have indication from the State Department of Health and the governor that we were going to omit from our numbers positivity and hospitalizations from those people who are incarcerated and corrections officers. And we still have not received any clarity on how they are guaranteeing to us that those numbers are not being included. So those are just the topics that I wanted to make sure that we're addressing with the State Department of Health in advance of the pulling of the data and the announcement.
I did follow up on an email just shortly ago on the breakthrough cases. We're currently at 19. Those are ones that the Department of Health has actually gone through and confirmed as breakthrough cases. One of those was hospitalized. So I did include all the dates for those. You had a lot of information there, so trying to go back and think. The corrections officers and inmates, those are based off of addresses that get pulled. So our inmates and our corrections officers get tested routinely, and so the address is located on the Front Street address for the county jail, and so any one of those would be removed through the Washington Disease Reporting System. They would filter those out. I believe Brittany.
Melissa, I'm sorry, just not to get how would we guarantee that? What if a Department of Corrections officer determined that they were going to go to the hospital and they were admitted outside of that, because then we would be basing it off of their home address. So how are we guaranteeing that that's not happening?
So that would have to be just done through case investigation to identify them as a correction officer. Their job status doesn't get pulled in unless we're actually able to contact the person, which we know from our locally case investigating locally that we're only able to reach about 60% of the positive cases. So I'm sure that there's some that we aren't capturing as corrections officers, but that's not something that they report when they test an individual.
So there's no way for the state to guarantee to us that they are indeed keeping those numbers out of our totals.
I would have to defer that to the state to find out what where they're pulling their data from on that.
Great. If we can find out, that would be wonderful.
Okay. And I know that there was for hospitalizations, there were no hospitalizations for assisted living or long-term care during that weekend, and just a couple of cases during that time frame. An outbreak. On the sit rep, there are noted to be a couple of outbreaks, but for long-term care and assisted living, an outbreak is defined as one resident or 2 staff members. And you have to go 28 days without another case for your outbreak to be considered over. So although we think of outbreak, what we saw last spring when we had 80 cases in a long-term care facility, that's not what we're seeing right now. We've just got the 2 facilities, one with 2 residents and one with a resident and a staff member.
All right, yeah, thank you, Commissioner McKinney, and we'd be happy to meet with you and discuss, any issues or any questions you have, to just make sure that we're clear on exactly what data.
Yeah, and I just looked at Melissa's email, and so I do have a concern because there are a great number of those 19 are included in the dates that we're being looked at. So those breakthrough cases. So I think it's something that we definitely need to address with the state if they're going to base our moving forward or backwards off people who've received the vaccine and have a breakthrough case, that's actually, again, not an indication of community spread.
Okay. Any other questions on phase updates before I move on?
I just wanted to share, Commissioner McKinney, we've had many conversations with our board and with individual board members about the importance of communicating with the state in advance of those changes. We've done that, and we are positioning a great deal of time this week to doing just that. We want to reduce any confusion or misunderstanding, or frankly, as Melissa indicated, missteps by the state. The information that they have is the information we have.
Okay, thank you.
Okay, and then the last item that I have is just an update on the health officer recruitment update. There's no vital information. I know we do have Dr. Atterbury on, so just any conversation, then we'll just ask him to leave. But just the update would be that we're looking to schedule interviews for the first week of May, but it was really difficult to get everyone's schedules, all 6 board members, to find a time. So we pushed it back to the second week of May, and that's what we're going to be working on now, is trying to find time where we can do those interviews.
Would you like me to drop off?
Is there any other questions where we need Dr. Atterbury to drop off, or we're good?
Still public meeting, Ryan, so I'm not sure it would matter.
Yeah. Okay, so we're trying to find time to do all 6 interviews on the week of May 10th. So if you can make yourself as flexible as possible, that'd be great. It is difficult. Everyone's got busy schedules, so it is difficult to find time for all 6 board members to be there. So if there's no questions, then I am done with my report.
Thank you, Ryan. We'll move now to Local Emergency Response Coordinator, Mr. Nathan Johnson.
Good morning, everybody. So I'll give some updates as far as the big happenings with our FEMA vaccine site. So as of last night, we've administered a total of 26,446 doses through that site. That's in combination between the fixed site and 97 first dose mobile clinics and 11 second dose mobile clinics since March 30th. And again, that a little over 26,000 includes both first dose and second dose numbers. A majority of that is first doses. Last week, we have transitioned the site. So the first 3 weeks of the site was all first doses from the federal supply. And then the next 3 weeks is all boosters, but we are still receiving first doses from the state allocation. So we're still able to do first dose mobile clinics and also first dose opportunities at the fixed site as well. The goal for the site was to do the final 2 weeks of the project with Johnson & Johnson, but due to the vaccine hesitancy around J&J, we're working with our FEMA partners and our state partners to get in 2 weeks of first dose Pfizer. And then after May 31st, when the project ends, we would still receive the boosters from that, and we would just push that out locally with our local partners. Again, I do want to highlight the amount of mobile clinics we've done. It kind of breaks down into, I believe it's right around 24, 25 a week that they're doing. This is in a wide range of locations, from agricultural warehouses. They've been along the Greenway. They've done businesses. And I really like highlighting the mobile opportunity because this is the first FEMA site that has the opportunity to do mobile sites. And that's us in the state recognizing that for our community, that's going to be our bread and butter. That's how we're going to be able to reach our community in a more efficient fashion. At the beginning of the site, we were noticing a lot of West Siders coming through. We've really, and huge props to Lillian and her communications team. They've done a lot of Yakima County centric outreach efforts. We've also pushed mobile sites throughout Yakima County. And so since the end of March, really it's been a 38% cumulative portion of those vaccines being delivered to Yakima County residents. But just between April 23rd and 25th, we're seeing it increase to 52%. So we're definitely seeing as, again, we push more mobile sites and we push more outreach efforts, we're really doing a good job at reaching our community. And then I think Andre mentioned this earlier, and again, this site is really seeing some really good best practices that FEMA is utilizing at other sites throughout the nation. They're using us as an example on how partnerships should work. We have 12 different partners on site, at least 12, all between nonprofit, private organizations, local government, state government, federal, Department of Defense. We have our state incident management team. We have a lot of players over there working collectively, and every day it's just working together for the mission and getting through the hurdles. But it's been really successful, and again, not something seen in very many operations of this size with this many different moving parts and players. So we are incredibly proud of all of our partners who are working together with us on that. We still have a lot of work to do around vaccines. We are seeing that less people are scheduling appointments throughout the county. We're seeing that providers in turn are ordering less vaccine. There's a couple reasons for that. There's the governor's mandate that providers need to use 95% of their vaccine within 7 days of receiving it. And if people aren't scheduling appointments, they don't want to just continue ordering vaccine just to have it sit or possibly expire. So they are being very cognizant on what they're ordering. In turn, that's putting a lot of pressure on, again, Lillian's team on doing a lot of just really creative outreach efforts throughout the community that I'm certain she will be able to highlight. But right now, as it sits, a little over 32% of our community has initiated vaccines, and a little over 24% are fully vaccinated. And that's according to the state dashboard that's on their website. So we know we have, even though it may be a personal decision, there's still a lot of opportunities to do education and outreach to the community, informing them where access to the vaccine is and how to reach those resources. Going forward, I already touched on the last 2 weeks of the site, moving towards Pfizer and Pfizer. We're going to really continuing pushing our outreach efforts. After May 31st, we're working with a contracted partner that's currently working at the site right now. They're going to staff up and they will continue to operate a small scale drive-through site at the Sundome, but as well staff up and continue operating mobile sites, because again, we know that that's going to be our bread and butter on really getting out into our community.
Nathan, can you confirm real quickly, you sent out a spreadsheet, and I just wanted to make sure I read it correctly, that there were only 3 providers who requested for this entire week 400 doses total.
So there was 4. So there was Yakima Health District. We requested, I think, 2340
for the FEMA site, correct?
Yes, that's for our FEMA site, but that's through the state allocation. And then we had 3 other organizations that requested Moderna.
So there were 2 that requested 100, and 1, I believe it was Planned Parenthood, requested 200. So a total of 400 vaccines for the week were requested outside of the health district.
Yes.
For the county. Thank you.
So that's kind of where we're at with vaccines. We know, like I said, we have a lot of work to do. There's still a lot of people, not only in our community, but throughout the state and throughout the country that are still, they're not totally against it. There may just be opportunities for some education and outreach to get them a little bit more comfortable with it. And so that's our goal moving forward, and to ensure that we continue having access to the vaccine readily for the community. And I'm happy to take any questions.
Have we had to destroy any vaccines? I hope not.
Not through the FEMA site. Providers throughout the county have had to waste some doses over the last few weeks. Because again, they're expiring, and if no one's they don't have anyone to put into arms.
So do we know the number of how many vaccines that had to be destroyed?
I do not, and we currently don't really have a way to track that.
Could you please reach out to each of our providers known to have received the vaccine in the county and ask them to advise us how many vaccine doses they had to destroy?
We could certainly reach out to them.
Thank you.
Does that, your numbers count the Horizon Pharmacy in Wapato?
Numbers specifically in
Vaccine
which
requests.
I'm sorry, Dr. Atterbury, what was that?
Oh, sorry, vaccine request. You said only 400, but I know that they're distributing mass numbers of vaccine through that pharmacy.
Yeah, so if we get a report every week, and they are included whether or not they will request vaccine from the state.
Got you, but you don't know if they're not getting it through a federal agency or some other agency.
Correct. So currently they are not. They are only receiving it through the state allocation.
Got it. And one second follow-up to that question, because of the moratorium or the short moratorium on the Johnson & Johnson vaccine, is there a large glut of that vaccine at risk for expiration or waste?
Not that I'm aware of. We've, as a county, we really haven't received a whole lot of Johnson & Johnson. I think out of all the vaccine, it makes up about 5% of what we've received. And a lot of what the Johnson & Johnson that we have received has come through the HRSA programs to both neighborhood health and to Yakima Valley farm workers. And they've been able to push those out. I will say, though, that the recent pause on the J&J has affected vaccine hesitancy, again, not targeted towards just our community, but throughout the entire country.
I think that we as a public health district should try and message strongly that the benefit of the vaccine far outweighs the risk of cerebral venous clots. Though terrible a condition, COVID is as or not worse terrible. So I think we should really push that message.
Absolutely. And I know Lillian and her team are working on a lot of different creative ways to push outreach out.
Thank you, Nathan. Is that the conclusion of your report?
Yes, thank you.
Thank you much. We'll move on now to Dr. Yucca.
Okay.
Good morning.
Good morning. Can you hear me?
Yep.
Okay, good. I'll be very brief. We're really short of time here. Most of the stuff that I was going to cover has been covered. We're going the wrong direction. We have increased cases, increased hospitalizations. We still have 18 deaths. That's significant for this last month. And we're still seeing cases, social gatherings and athletic seems to be the two areas where we're seeing our cases. So we have to do better. I hope we do better. We're counting on it. And with warm weather coming up and more vaccinations, and vaccinations will really make us or break us. And we need to do better on that. There's kind of an apathy out there, I think, in our public, and all of us that can really push vaccines, we pretty appreciate it, because that's going to get us back to normal as fast as anything. So, and I'm glad to see J&J back on the market, and I'm with you, Dr. Atterbury. It's we will push it. It's a good vaccine, especially the one dose in many of our populations. So with that, I'll stop, let other people.
Thank you, Doctor. Appreciate it. We'll move on to Melissa and her report.
Thank you. Just to follow up with Dr. Yucca and Dr. Atterbury, we did send out a provider advisory the other day when it was announced Johnson & Johnson could be used safely again. And so we did send out a provider advisory asking providers to start looking at that vaccine again and start using those up. We kind of looked at who's been hospitalized over the last 30 days, and it's most of our hospitalizations are those in their 60s compared to what we were seeing, prior, 70 plus. So we're seeing less of the 70 plus and more in the 60 range, which makes sense. Those people have been hospitalized. A lot of our hospitalizations previously were from long-term care residents. They're all mostly vaccinated now, so that makes sense. The deaths in the last 30 days, our median is 65 and our mean is 66 for those. So we're also seeing a decrease. We were seeing deaths at a higher age bracket before, and in the last 30 days, those have come down. One of the things I'm happy that the Center for Medicare and Medicaid Services, or CMS, has come out with some new visitation guidelines for long-term care facilities, which is great, which will allow for some visitation. These family members haven't seen their families or touched their families in over a year. We've seen many cases of failure to thrive. There just was no leniency on these long-term care facilities. And now that these individuals are being vaccinated, it's allowing for visitation for their families. And something else I've been working on is I've really been pushing the state to come up with some guidance for hospital visitors. We're still on a very limited visitation policy, and each hospital has their own visitor policy. But I think the state coming up with recommendations for the hospitals would encourage them to loosen those restrictions for those individuals that are vaccinated, the family members that are vaccinated, to be able to come in and see their loved ones. So it's something that the state's currently working on guidance, but it's hard to read chart notes and see individuals dying alone. So something else that we're really working on. And I'll stop there.
I'm sorry. I didn't.
Thank you.
Melissa, if I could just interject, I appreciate your comments about hospitals. As someone who's worked at a hospital for 15 years, and I have a wife who still works there, I know that having those visits, particularly when you look at the fact that we can isolate COVID patients safely, and the COVID numbers of, in the hospitals are down, and sometimes we don't have any COVID patients in some of our local hospitals. It seems to be prudent to say that we can have visits and it can be done safely, and it'll be of tremendous psychological and emotional benefit to those patients. So I appreciate you pushing the state in that direction. And also, we also appreciate you're looking over those numbers very carefully, as they will have an impact on whether we stay in phase 3. We truly do want to stay there. It's a benefit to obviously our businesses and the community in general.
Absolutely.
I just wanted to reiterate the same, Melissa. Thank you for really watching those numbers and working with the state and the county on that, and also for your efforts to allow the people in our hospitals and our long-term care facilities to have family visits. That is so critical to their ability to thrive and to their mental health. So thank you very much.
Thank you. Before we move on, there are some 26 participants, and I'm only seeing 2 names. I would appreciate if the others who are on this meeting, please put in the chat room your name and identify yourself, please. Thank you. We'll move now to Sean and environmental health.
Yes, thank you. So real quickly, one thing, I was updated by our outbreak response team just for the board's awareness. Since February 8th, there has been 6 different incidences where sports teams had to quarantine due to having a positive case, and team members having been close contacts to that positive case. 4 of those quarantine events have happened since April 1st. To date. So just for board awareness, that's across our school athletics. That's how many possible transmission events we've seen that caused our local sports teams to end up quarantining and not being involved in practice and competitions.
Were any of
Are
those?
those indoors or outdoor sports?
I can get that for you.
I'd also like to know if any of those were hospitalized.
3 of them were outdoor sports. 3 of them were indoor sports. And it does not say in this report that, this report won't tell me if any of them were hospitalized, but it says, anywhere from 1 to 3 students, athletic students, have tested positive, resulted in at least 1 or more cases. And in this incident, the entire team was close contacts. So whether they're hospitalized or not, I don't have that data in front of me. That'd be something we'd have to look back through.
I think Melissa had asked you for that. So I think you're following up with me. I'd asked for the demographics for everyone who's been hospitalized and for those 18 people who have perished in the last month. So specifically wanting to know all the demographics for the people that we're going to be looking at in the April 10th through the 23rd and the 14th through the 20th. I think it's pertinent to know who's being hospitalized and what their ages are and any underlying conditions they may have.
Yeah, and that data is being close to being complete, and we will make sure to send that out to all board members.
Thank you.
Can we also, just to add to Amanda's comment, can we also get what they were treated with while hospitalized? Were they given just palliative, IV solutions, standby oxygen, remdesivir? How were they treated?
Any other questions on that stuff?
Yeah, another thing that I'd like to also add to that is how many, as a result of those teams that were quarantined, through the contact tracing, how many other people were exposed or ended up with COVID. I think that's also important because when people are participating in these types of sports, like what is the far-reaching outcome of COVID spreading into the community and to the families?
Gotcha. It's a little spread out in the data I'm looking at here, but I can quantify the
the close contacts that were identified in this report. And I can have that sent to you guys if that is what you want.
Thank you, Sean.
Yeah.
Anything else?
Real quickly, for environmental health, not related to COVID, we are continuing restarting our in-person food safety inspections of our local restaurants and food establishments beginning in May, first part of May, Monday, May 3rd. Staff will be back out in the field and working with restaurants and food establishments. We will continue our newsletter to all of our licensed food establishments that contains, hot topics for food safety, different educational points on that, and then also the latest COVID-19 updates that would have any effect on how our food establishments can operate throughout, the different COVID restrictions. So we'll be starting on that. Also, we are interviewing for a new environmental health specialist later this week. One of our environmental health specialists, Beth Snyder, resigned. She recently was married and moved to a different state to start a new chapter with her husband. So we are filling an open position, hopefully this week.
Okay.
That's everything for me.
Thank you. We'll move on to public health partnerships with Lillian.
Thank you. So again, as you heard, our team continues to work to promote vaccine availability and education. I do want to reiterate that our approach to address vaccine hesitancy is to provide accurate information to counter the misinformation, as well as to work with our local community members to put a face to the many people who are choosing to get the vaccine. So in addition to this, we're making sure that they have those no barrier options, as has already been discussed with the community vaccination site and with the mobile teams. So we really just want to frame the vaccine as an opportunity for hope and an opportunity to move forward and end the pandemic. And so to accomplish this, we have worked on public service announcements that include various community members talking about why they chose to get the vaccine, their experience getting the vaccine, and what they are looking forward to now that they have received the vaccine. So you'll likely see some familiar faces on there, including a few of our board members. So thank you for those of you who are able to participate. I know I'm happy to provide a summary of other outreach and education efforts later this week in the interest of time. And I did want to quickly share that as part of the Developmental Disabilities Program, we currently have 6 employment providers that are subcontracted through the county's Developmental Disabilities Program that beginning in May 2021, we'll be inviting another employment vendor called Trillian Employment Services. So we will now have 7 employment providers for those that have developmental disabilities here in Yakima County. Thank you.
Thank you. Any other business that we need to address? Hearing none, I will entertain a motion to adjourn.
Move to adjourn to the next scheduled meeting, which I think is, I'm looking real quick trying to find that.
May 12th.
Thank you, May 12th.
Well,
I'll second that.
been moved and seconded to adjourn to our next regular scheduled meeting of May 12th. Any discussion? I hear none. All those in favor?
Aye.
Aye.
Any opposed? Hearing none, we are adjourned. Thank you all very much. It was a very lively discussion. Much appreciated. Thank you much. We'll see you on May 12th.
Thank you. Have a good day.
Thank you, everyone.
Thank you.